Today, I'm delighted to welcome Dr. Lisa Medoff, learning specialist at Stanford School of Medicine and developmental psychologist specializing in adolescent and young adult education. For over a decade, Dr. Medoff has been guiding Stanford medical students through their academic journeys, with particular expertise in USMLE preparation, learning strategies, and supporting students with diverse learning needs. Beyond her work at Stanford, she maintains a private practice helping students with ADHD, learning disabilities, and mental health challenges develop effective organizational strategies and self-advocacy skills. Dr. Medoff brings a unique perspective shaped by her 15 years teaching things like human biology undergraduates at Stanford, her own PhD research in adolescent development, and her extensive experience working with learners across different developmental stages. Her expertise in balancing academic demands with mental well-being makes her insights particularly valuable for anyone navigating the challenges of medical education and beyond. So, Dr. Medoff, thank you so much for joining us.
Thank you so much, and thank you for that lovely introduction, Dr. Palmerton.
I like to start with a simple question, which is, what's one unconventional piece of advice that you give to medical students that goes against common wisdom, but is proven to be useful or effective?
That's a good question. I think the one that comes to mind right now is, especially when you're starting medical school, but as you hit different milestones, things like studying for step 1 or figuring out clerkships, there's a lot of information floating around out there. There's a lot of rumors that you hear, people saying you have to do this, you have to do that. And then, of course, there's all kinds of videos, some like yours that are more helpful and some that maybe aren't as helpful for everybody. And then, of course, there is the Reddit rabbit hole that people often go down. So there's just so many different places that people try to get information from. And so what I often recommend, whether it's to first years in their first week or two or students trying to study for step 1, is rather than trying to gather all of the information and then figure out on your own what is best for you, is to find 1 or 2 upper class students, like TA or just somebody that they know from working together in another project, somebody who's similar to them in some way, whether that's in learning style or personality or working habits, or just somebody that they look at. You know, we all have those people that we look at and we say, I admire them, I would like to be like them, and ask them for advice. So rather than trying to sift through everything, find 1 or 2 people that you feel like might be similar to you or a good mentor to you, ask what they've done, and then try to close your ears to a lot of the other things floating around out there, so you're not constantly going, oh, I should be doing that. No, wait, I should be doing that instead. Oh my gosh, and I'm overwhelmed. And when we get overwhelmed, that's when we shut down and don't want to do anything.
Yeah, it's kind of like it's easy to move 1 inch in a million directions and end up really kind of going nowhere. And so that's very useful advice to, find that person that's similar to you. Like, how would you, I think a lot of students, like when I went to medical school, one hard thing is like, I felt really intimidated by people that were older than me and sort of seeking out those people. Like, what advice do you have if, like, how do I find those people, especially if it's more than a year beyond me? Like, if they're truly like 3rd or 4th years, like,
yeah, and it may depend on the school that you go to, but I know at Stanford we have not only are the TAs are upper class students, so the TAs are always really good people to go to ask for advice. They always want to help. I run the tutoring program at our school, and so a lot of my TAs are tutors, and they say, what can I do to help students? There's lots of other things that you can go to. Sometimes there's networking events. As you know, as a med student, I am sure you are always on the lookout for when you can get free food. So go to those, chat with other people, and sometimes it's hard to do. I know myself, I'm a very shy person, especially when I'm in a group, and sometimes I have to push myself to just say, okay, I'm going to go to one event and I'm going to talk to one person. Look for somebody that looks a little friendly, and just start asking them questions. I think we are all we like to talk about ourselves. And so I know if, as you are doing, if somebody asks me a question for advice, I'll go off for the next hour. Especially if somebody says something, I really admire some of the work you've done. And if you don't know anything about them, you can just start chatting with them. What are your interests? What's your background? What was your hardest class? So think of some questions that you might want to ask. But I find that generally, especially people who want to go into the field of medicine, are very, very helpful and happy to mentor. Another place that you can find people is if your school has somebody like me, like a learning specialist, or anybody else in student services. Tell them what you're looking for, and see if they have any suggestions. I can introduce people if they're interested, or if you have at Stanford we call them advising deans. So anybody like that you're working with, ask them if they have any students that they recommend that they can set you up with, or even sometimes I'll go to coffee or lunch together.
That's great advice. It sounds like, part of it is just put yourself in a position where you can meet more people. Like obviously you're going to meet your TAs, so that's a very natural way that you can do it. All of the free food events, like you can kind of, double dip, no pun intended, on like meeting people and, sort of like learning new things. And then in addition to that, it sounds like be very clear about what it is that you're looking for, and just be okay with just telling other people like, hey, I am looking for mentors, or I'm looking for sort of upperclassmen that I am, that I can learn from, that are maybe similar to me in maybe X, Y, and Z ways. Like talking even to your dean. I hadn't really thought about that. That's really good advice. Speaking of your work, how did you end up, you have a very interesting background, right? So you are both the learning specialist at one of the top medical schools in the country, and then in addition to that, you work with sort of like a wide span of people in your private practice for, like psychology. How did you come to have that sort of interesting?
That's a good question and a very long story. I will try to make it a little shorter, but what I will start with is answering that with two questions that I talk to college students or high school students or anybody else that I'm working with if they're trying to figure out, so what do I do next? And notice that I said next and not what do I do the rest of my life. So I think that can be a little daunting to think about it that way. But I always think about, I tell students, think about what's the next step? What do you want to do, say, for the next 3 to 5 years, and what credentials or job experience do you need to get to do that? But underneath that, I asked them two questions. One of which is, what about the world makes you mad? I'm sure nobody has an answer to that question these days, but what about the world makes you mad, and what small part of that can you work on fixing? Not fix everything, don't take on too much, but what small part of that can you work on? And for me, ever since I was an adolescent myself, I remember thinking, it doesn't have to be this hard. It doesn't have to be this lonely. It doesn't have to be this, like, I have so many questions, and even though I had a great relationship with my parents, like, sometimes didn't feel comfortable asking them certain things, but didn't know who to ask. And so I thought, I'm going to fix this someday. And I haven't fixed everything for adolescents, but I like to think that I'm working on it both through teaching and through working one-on-one with the kids and their families. So that's one question. And the other question is, what do you actually want to get out of bed and do every day? And who do you want to be around when you do it? And so for me, I really liked being around kids and families, and I liked being around schools, and I liked being around really smart, nice people who cared a lot. And so I know a lot of people watching this video will think, well, I'm already in medical school, I already kind of have an idea of what I want to do, but there's lots of choices within being in medical school, and there's lots of choices in terms of what your specialty is and what combination of work you want to do. And so I think no matter what stage you are in your career, you can continue to ask yourself those questions. And so I ended up, I have a master's degree in counseling, and then ended up going to Stanford to get my PhD in adolescent development. And in between my master's and my PhD, I had worked with a woman who had a practice in educational therapy. And I thought, ooh, That's the sweet spot. Helping adolescents, helping kids who struggled in school, but also had maybe some mental health issues that were making school a little bit difficult or perhaps caused by school. And when I got to graduate work, I was like, I miss kids. I miss working with them one-on-one. So I started my practice in Palo Alto. And I also ended up TAing a course in adolescent development. And it just turned out that by the time I graduated, one of my advisors was retiring, and she knew I would teach her classes exactly the way that she taught them. So that again goes to the power of connecting with mentors and learning from them and establishing relationships with them, because you just never know when job opportunities are going to pop up for you. And so I just was able to combine doing several things. And I think that's another piece of advice I would give young people, whether you're in high school or college, medical school or beyond, is I think a lot of times we get the message, specialize, specialize, special. You have to pick one thing, and that's the only thing you can do the rest of your life. And I sometimes like to give the opposite message, that if you're interested in a lot of different things, find a way to see how those things can overlap with each other, or you do one thing for half the time and another thing for half the time. And while that might be stressful, it's never boring. And I think it also gives you a little bit of a cushion, especially in uncertain economic times. You don't have to be so worried necessarily about one thing. So, different trade-offs. But so when a job came open at the medical school and somebody told me about it, I went, wow, okay, I've already been working with pre-med students, and I already have a private practice doing something similar with adolescents. I think I could scale up to work with medical students. And I also, as an adolescent psychologist, tend to see the world through the lens of adolescence. And every time you have a new start or a new transition, even the first day of medical school orientation, it can feel very much like that middle school lunchroom on the first day. But a lot of the tasks of adolescence, we're all starting over again anytime we start something new. And in medical school, it's figuring out my identity within this new environment, navigating the balance of academics and relationships, seeing, am I smart enough to be here? How do I navigate the academic piece alone? And of course, dealing with any other emotional or mental health issues come up. So anytime we go through a new start, we're those early adolescents again.
Gosh, there's so much to unpack there. I love the framework of, like, how do I choose what it is that I do, that you have applied to your life, and it sounds like you use as sort of like a guide for other people. I love the, like, I've heard a lot of like, oh, do what you want to do, like, who do you want to work with, things like that. But like, what do you hate in the world is a really, I think, interesting take on the, like, just focus on, like, what's the thing that really animates you, even just negatively, and then figure out, like, okay, well, let's just do the opposite to try to fix it, right? Like, let's try to be a part of the solution of that, I think is brilliant. So you see kind of the span. I mean, you see sort of like the span of people's sort of difficulties from adolescence to, like, all the way through a very, very rigorous medical school. You mentioned off camera that it like sort of medical students in many ways are just kind of, it's just everything that you see with like younger children.
Oh,
can you expand on that?
I think it's funny. I grew up, my mom was a preschool director, so I grew up working in her preschool, which is why I don't work with younger kids, but I had enough of that when I was a little bit younger. But I think a lot of the issues are the same. So like I was saying, I think for younger kids, like our 2 to 5 year olds, they're developing their autonomy and their independence. And then adolescents, I think what you're referring to is we spoke about the needs of adolescents, and I wish I knew who to attribute this to. I learned this a long time ago in grad school, but in the field of adolescent development, we talk about the needs of the ABCs of adolescence. So the A is for autonomy or independence, and B is for belonging, and C is for competence. And one time I was giving a talk to teachers, and it started going on, oh, this is what adolescents need. We need to help them be independent and make their own choices when they can. But we also need to make sure that they feel like they're really cared about within the classroom and that they have a good friend group and either feel like a good part of their family, or if that's not a good situation for them, that they have something else like a sports team or religious group, or are involved in theater or something where they feel like they belong. And then competence, they need to feel like they're good at something. And adolescence is a time when you start to see more competitive grading and, figuring out like who's rising to the top. And I was giving this talk and really advocating for adolescence, and a teacher raises their hand and says, excuse me, teachers need ABCs too. And I think you and I talked about it. We said, yeah, everybody needs ABCs, whether it's our little preschoolers or adolescents or older people in a job and medical students. And so I think that's something that we have to think about. Those of us who are on the side where we can help influence the culture that medical students are in, is we have to make them feel like they do have some independence and some ability to make their own decisions, even though they are working within a hierarchy for very good reason. There are very strict milestones that they have to meet in order to be able to move on. But there has to be some feeling of choice, some feeling of, I think another part of autonomy is feeling like we have control over our lives. And when you are in medical school or when you're an adolescent, you can just feel like I have no control over anything, and even controlling things like your schedule. And even if we have to get down to that little piece of that's the only thing that you can control, is you can decide when you study, and you can decide when you take breaks, and you can decide who you spend your time with. We all have to feel like we have a little bit of autonomy or independence. And then B, belonging is so important. We have to feel like we are part of something bigger, that we matter, that people understand us, that we can let our guard down and be ourselves and not have to monitor our speech or behavior all the time. Some people have to do code switching, or some people just have to feel like, okay, the way I present in school or on clerkships is not really who I am when I'm at home and with my family. And so we have to make sure that people have spaces where they feel like they belong. And then, of course, competence. I think there's nothing like a blow to the ego like starting medical school, right? And feeling like you were really, really good and you worked so hard, and you got the good grades and you were involved in different organizations, and then just that blow that comes when you feel like, oh, I studied so hard, I couldn't have put in any more time, and I got a really bad grade on that first exam in medical school. I always say now I work remotely via Zoom, but when I worked on campus before the pandemic, I would always say I knew after the very first class, first day, first class, Monday morning, I would have a line of students outside my door, line of first years, saying, I think I made a mistake. I don't think I can do this, or help. I need to meet with you 40 hours a week. And so I think part of my job is also helping to reassure and normalize. And one of the things I always tell students is, I'll say, I'm not somebody to say like totally trust in institutions and don't ask any questions ever, but to trust that the field of medicine has an understanding of all the milestones you have to get through. You're going to see things several times over and over and over again. So if you don't do perfectly on the first exam your first year, it does not mean you're not going to be a good doctor. It does not mean you're not going to be successful. So I think just normalizing that change from being like super successful in undergrad and then maybe not being able to be successful, or at least right away when you first get to medical school. So anyway, another long-winded answer to your question, going back to the ABCs that we all need, not just adolescents: autonomy, belonging, competence. So no matter if we're the students or the people needing it, we need to seek those out and make sure those needs are fulfilled. And if we're the people more in charge of the institutions, we need to make sure that those aspects are there for our students when they need one.
That's super powerful. This is very, very, very powerful framework. So I just want to, for anyone listening, I want to emphasize this point of like the ABCs. So I think another, I don't know if it came from like the work on intrinsic motivation or the field of intrinsic motivation, but there's a lot of similarities of like, I want to, intrinsic motivation obviously meaning I am doing the thing because I love the thing, not because of the reward I get from the thing. Like, so I study not just because I get good grades, but I study because I've learned to love studying. And the ABCs are really kind of that key to unlock, like, loving what it is that we're doing. There's a student that we worked with. He was like, it was sort of the extreme version of what it is you're talking about, where he failed step one and just like could not get out of bed. Like I remember he just like was just devastated, and had been pretty competitive up until that point, had gotten sort of above average grades, but just was despondent. And once he learned, especially the competence piece, like once he started to see like, oh, okay, like, we changed the way that he was studying things, we started smaller, he started to get like 80% on things, like it just clicked. And so now he ended up scoring like a 262 on his practice test before he retook and passed. He ended up matching into urology, which is like obviously super competitive, like completely changed the trajectory really just from the ABCs. So that's, again, just to
Yeah,
emphasize just
yeah,
how
and that's
powerful
really
that
important.
framework can
I
be.
think sometimes, and especially the students that are very high achieving, to go back to those adolescent tasks of identity. And that's what our system asks of you in order to get into a quote good college and then a good medical school. You have to make your whole life about school and achievement and what's going on your resume. And so that becomes your entire identity. And a lot of times for our wonderful high achieving medical students, they haven't necessarily failed before, or they haven't struggled too much. Even that's not to say they weren't working hard; they really were working hard. And so the first time that happens, that can just be devastating, and we can retreat to our beds and say, "I can't do this," and my whole life has been a waste. And I think going back and figuring out where can I, it sounds like what you did with that student is, where can I have those small successes so that I can build on them and build on them. And so I think that's one thing, is that you don't have to be perfect right away. It's just thinking about improving little by little, and especially with step one. I always tell students, when you take that first pre-test or first NBME, do not be surprised if you get like 20 or 30% or even lower than that, and that's okay. And you can make your way up. It seems a little bit intimidating, but it can be done. It's hard, it's not easy, but students do it. And then I think the other part of it is, you were talking about that intrinsic motivation. One question I ask students that I'm working with is, what's your attitude about this? And I don't mean like, oh, you have a bad attitude, but we all have these things that we have to do where we're like, oh, this is so stupid. Why do I have to do, like step one, why do I have to memorize all of these details and spit them back out on a test, when that's not really what being a practicing physician is all about. And I am always going to have a computer, or I'm always going to have colleagues to consult with. I don't need to have all this memorized. And so we talk about finding ways to shift their attitude so that their motivation does increase. So sometimes it's hard to think about step one. Oh, I'm just memorizing. I'm spending, a month or two of my life just memorizing details for this test, as opposed to thinking about, okay, well, I will have this foundation of knowledge at my fingertips so that when I am working with patients, I will have that knowledge for them. I will feel more confident. And sometimes I'll even tell students, because we have a lot of medical centers on campus. If you're really if you're stuck in your room or in the library all alone and you're not feeling motivated, go study in the hospital cafeteria, or go study in a quiet room in the cafeteria, just so you can be reminded of why you're doing this. And sometimes that helps.
Yeah. It's kind of like two of the ABCs, right? It's like the autonomy. It's like you're making the choice of where it is that you're studying. You may not be able to choose like that you're studying, but you get to choose where you study. You have the autonomy of choice, and it's sort of like that belonging, that meaning of like remind yourself of why it
Yeah.
is that you're doing that. It's very powerful. So let's say that I'm that student that is 20% or 30%, and I've got like a month until my test or 2 months until I'm supposed to take my test. Like what would be your approach? Like what would you tell me if I'm like really really far away from my goal and
Yeah,
I
yeah.
I
Well,
can't get out
so
of bed?
first of all, we deal with some of the mental health issues or some of the motivation issues and make sure that students have the support that they need. I always offer to be that support. I say, you can email me as much as you want. We can meet as much as you want. And I also tell them, I don't want you rattling around in your head by yourself with this. So if you have any thoughts, whether it's like, this is so hard or this is so stupid, why do I have to do this? Or all the terrible mean things we say, hi, this is as high as I can go, or I'm never going to get this, or what is my family going to say if I flunk out of medical school? Is I say, take those thoughts out of your head, dump them in an email to me, and get back to work. So we have a plan for that. Sometimes I even tell them, open up a little Google Doc and make a chart that says, like, here's the mean thing I say to myself. Here's the rebuttal. I know we're talking about medical students, but let's be lawyers for a little bit, or at least debate society members, so that they're ready for when those thoughts come to say. So say, CBT in 10 seconds here. So when those thoughts come, let's be ready to combat them. Let's have a plan if you feel like your day is just packed and the minute I get out of bed, that's like 16 hours of study, and that's going to be miserable. Well, let's find a way to start getting you out of bed. Maybe you don't work first thing in the morning. What can you do first thing in the morning that might, maybe it's take a walk. Maybe it's watch a funny video, although put a time limit on how long you're going to watch videos for. So for some people, we don't even want to get started, opening a funny video. But do something in the morning where it feels a little bit easier to get out of bed, or plan your schedule where you have a lot of breaks. So for some people, this is also sort of a physician, know thyself. Are you a person where it's kind of hard to get started, but once you get started, you're going to sit there and focus for 6 hours and then you're like, I'm done and I need a break? Or are you the kind of person that the thought of that is going to keep you in bed, and maybe you say, I'm going to work 15 minutes and then I'm going to get up and take a quick break. I'm going to work 15 minutes, take a quick break. So also think about what you need in terms of being able to get out of bed and face the work that you have to do. So we talk a lot about those things at first, and really acknowledge, like, what are the feelings behind why you're struggling a little bit. And then we get more into the academic piece. Usually, number one is I prepare them for that score to be low, and I tell them, everybody starts that way. And also on step one, these days, thank goodness for pass fail, you're not trying to get from, say, 20% to 100%. You're trying to get from 20% to about 60 to 70%. So also reminding them of it, they don't have quite as far to go as they think they do. And then we start with where they are. I will usually say, I think one of the mistakes that people can make when they start studying for step one is they just start doing just random questions, and that's it. And they're just like Q bank, random questions. And that feels like just like millions of bits of trivia coming at you. And so what I will tell them to do is take a step back and start doing the question blocks, one content area at a time, so that you can start to see the patterns in what does the test want me? So let's say we're doing cardiology. So what does the test want me to know in this content area in cardiology? How do they ask questions about it? What are some of the patterns? And then what are some of the patterns in some of my strengths and weaknesses in cardiology? And I find that going back to that idea of students feel like they have a little bit more control. It doesn't feel as random. And especially if they're feeling a little bit demoralized or having a hard time getting started, I'll say it's okay to start with some of the easier stuff. Start with the topic you're really interested in, or start with the last unit that you did in your preclinical education. It's okay to start a little bit easy and then ramp your way up. So everybody's a little bit different in terms of, do they feel like they want to do like a big content review, watch a lot of videos, do some readings, memorize things, and then go to questions, or do they want to just jump in with questions? And I will say, if they don't have a preference, I generally recommend starting with the questions and keeping track of, it doesn't have to be a fancy spreadsheet. Don't sometimes making all of these structures, making the plans and making the spreadsheets can be some procrastination. So it doesn't have to be fancy, but keep track of when you miss a question, why are you missing it, so that you know what to focus on. And again, it makes things a little bit more systematic than just like, all I'm doing is questions, 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 and I'm not sure what I'm taking in. And I will say, the questions are the boss of you. So let the questions tell you where your gaps in knowledge are, and then take a step back. And then that's maybe where you have to watch some videos or go do some content review. But really working from where people are and figuring out what's holding them back. And then let's do a little practice with that.
Yeah, that makes a lot of sense. Yeah, we find the same thing is true of like, if you start with like just this big hairy goal, then like the audacious goal is so overwhelming that people just feel so overwhelmed, and they just like they don't even start, right? And so the key is to kind of chunk down, be like, okay, like let's not think about 6 hours, let's think about the next 15 minutes or even just like the next minute. And then let's not think about all of the content material. Let's just focus on like one system, or even like one subtopic. We had a student, she just told me, I just met with her yesterday. She had kind of similar problems around like the emotional stuff of like, she like wasn't doing questions because it felt really overwhelming, and she wanted to be perfect before she, that perfectionist kind of that mindset. And so we had to work on like reframing it and say like, okay, no, like between you and your goal score, which she wants to get like a 270, it was like, between you and your goal score, you're gonna have to make a lot of mistakes, right? And so just let's get through those mistakes. And she scored like a 68 on her internal medicine shelf, but she took a practice test just to like see what her improvement had been.
Wow.
She got like an 87. And so it's like, and she'd only studied like maybe one or two systems, like only cardio, because, she generated some momentum, because she was able to focus on those things. She was also able to practice a lot of the other things that you said of like, okay, I can learn how to read questions. I can learn how to like, just with that small amount of material. Okay, so I'm hearing you got to get some momentum, got to break it down. And then where do I go from there? So like what if I'm not ready? Like, what if I'm like, I've done everything that I thought that I could. Like, what if I'm not ready to take my test, or, I'm like kind of like on the border, and it's like my test is in like a week or two. What do you tell people?
I think it really depends. I would definitely meet with them. I would tell them to meet with their advising team and talk through. I think it's also thinking about, so are you just feeling not ready, or does the evidence show you? I always say, y'all are scientists. Let's look at the evidence here. And so I think everybody has kind of a different metric of where they want students to be. I always tell students, by about a week to 10 days out from your test, I like them to be getting, like, if they're doing random Q-Bank questions, I like them to be pretty consistently getting about 70% or higher, because passing is about 60%, but I like people to go in with a very large cushion. And then also on the NBME, as I say, by about a week to 10 days out, I like people to, the official test will say something like, if you take this exam in the next week, you will have X% chance of passing. And I like people to be at about 95% or above. Again, that's maybe a little bit higher than you need, but I like people to go in really confident. So that's the first thing. And so I'll say, okay, let's look at the data here. And if you're just not feeling ready, but the data is saying you are, let's talk about what's going on there and why you're not feeling ready. And is this more of a sort of psychological, emotional thing that we need to deal with? Or do you feel like these scores are not actually representative of what you know, and why? And then in some cases, I don't like to send people in unless we are almost positive they're going to pass. And so sometimes we just need to have a conversation about, you may need to push it, and let's talk to your advising dean and the clerkship directors and see what we can do to kind of rearrange things there. And I think sometimes students feel like I'm kind of 50-50 here. I sort of accept that I may not pass, but I want to take my chance and go ahead and take it and just hope that I do okay. And so we just make sure that they are prepared for just in case something. I was going to say something terrible happens, and that's a terrible thing to say. It's not a terrible thing. Sometimes people fail it and they take it again and they end up doing very well and they go on to have a good career. So I think it's also saying, like, of course we don't want people to fail, but we also don't want to give them the message that, like, that's the end of the world. And I think sometimes even students have this misconception, which is, on us at our school, like, oh my gosh, if I fail, they're going to kick me out of school. And I always tell them, no, if you fail, we're all going to swoop in and pile on you and be like, how can we help you? How can we help you? That might be worse. So I think it's also putting things in perspective that it's okay. It's not the worst thing in the world. And it may be a little frustrating or maybe even add on a little bit of time, but we're all going to help you figure things out. When I had, just to go back to students that say, I need more time, I need more time. I always tell students, if you're going to push it, if you're telling me you need another week or two, I want a very detailed minute by minute plan of what those next 2 weeks are going to look like, and you tell me how that's going to raise your score. And if there's just a general, like, I don't know, I need more time, they're probably ready. But if they're saying, oh, okay, I'm pretty consistently getting like low 60%, but I think if I just spend another week like really doing rote memorization and doing more practice questions in these 4 content areas, then I think I'll be a little bit higher. Then I go, oh, okay, that absolutely makes sense. So, one of those psychology answers of just it depends. But what I will say is, if you're concerned, this is back to that idea of like being anxious or worried at any point in the study period or any point in medical school. If you're worried, reach out to the people at your university. See who you feel comfortable with. It might be somebody like me, like a learning specialist. It might be your advising dean. It might be a professor that you really connected with, or another mentor. Tell them, what you're thinking and ask them for their advice. But don't do this alone.
Such great nuggets. I mean, I think I'm hearing, part of it is like, let's separate the subjective from the objective, right? Because on one hand, you've got, it's a big scary test, and it's like big scary things. We tend to want to like avoid them. Like there was ironically, it was a Stanford MD PhD who was several years after me, but I was tutoring him, and like he would not take his step one. Like he just like kept pushing it, even though he was like scoring like 70s or 80s. It was just like obscenely high, and I was like, why are you not taking this test? Like, but it was exactly what it is you were saying. He ended up matching at Harvard for his dream specialty, and so. But it's like you're like, what's going on? Like, why? So you have to separate the subjective from the objective. And objectively, it sounds like you're looking at, okay, I want at least 95% chance or more of passing, which I think is like about 65, maybe 66%, something like that in the NBMEs. And if it's not, so if it's not, then we got to figure out like, okay, well, let's figure out what it is that you're going to do, and especially let's use that outside perspective. Like let's bring in the experts, let's bring in the people that have seen this before, your deans, your learning specialists, those people that can look at what you're doing and say like, okay, like I think this is the blind spot that you're missing. This is what
because it's a very lonely time, right? For the most part, you're kind of isolated for anywhere between, like 4 to 8 weeks, or sometimes a little bit longer. And so, we all know that like when we're sitting by ourselves, whether it's like in bed in the morning, you're like, you can't get out of bed, and we're like doing all these worst case scenarios, or when you're sitting studying by yourself, sometimes your perspective is a little bit off. And so it's just nice to check with other people. And so that's something else I prepare them for, is when we're planning their schedule, is I want them to not just to think about academically, what are they going to do, but where are you plugging in some downtime? Where are you plugging in some free time? Where are you plugging in spending time with loved ones? And also I tell them, you need to prepare the people in your life for what you need and what you don't need. So tell people ahead of time, this is what you can expect from me. This is what I need for it. Once a week, can you just come and pick me up and take me to dinner and talk to me about some, general, some movie that you saw. Don't ask me how things are going and then drop me off at home or, leave coffee outside my door and otherwise don't talk to me. So tell people what you need, but also there has to be, at whatever level works for you. Some people are much better if they're like, nope, I'm isolated. I don't want to think about anybody else. I don't want to, deal with anybody else. And that works for them. And some people, and in fact, some students that I work with actually choose to take a study period that's a little bit longer because they say, I'm not going to make it if I could do it in a month of just working every day, all day and not seeing anybody, but that's not going to be healthy for me. So I'm going to take a little bit longer so that I can take evenings off and have dinner with my partner or my family, or I'm going to take full weekends off because I'm going to need a break. And I have some things that I do that are really important to me that help. One of my best friends has the phrase like doing things that feed your soul. And I like that. It's like you have to have some things in your life that feed your soul, whatever that is. That could be family or friends or volunteer work or religious practices, formal or informal or whatever it is that you do. You can't totally let that go. You can't do the other thing I tell them is you can't necessarily be like, well, I'm going to this wedding and then this graduation and then I'm going to this conference and I'll be finishing up this research and I have to get this paper in but it's fine. I'll just study around that. And I sometimes say, okay, let's be realistic about how that is going to work. So I think having some sort of balance, so not doing things alone and doing things at the right level for you in terms of what kind of outside contact do you need other than with your Q banks and first aid.
Yeah, there was a study that I saw once where they told people they had people write down all the
Oh
things that
yeah.
gave them flow, like kind of similar, like what sort of feeds your soul, and they said, okay, now don't do those things, or if you have to, some of it was like
Mhm.
walking
Yeah.
the dog or making coffee or reading the news. It's oftentimes very simple things, and they said don't do those things or do them sort of to the minimum. And what they found is that they had to stop the experiment after 48 hours because people were already meeting like most of the
Oh my
criteria for
gosh.
things like
That's,
generalized anxiety
that's so
disorder. Like
sad.
they just were zombies. One person like walked
Oh.
into a glass door. Like, but if I think back to medical school, there's so much pressure to kind of like
Mhm.
take out all of those things. And it's a very, very powerful reminder to say like, no, actually you do
Yeah,
need
and
you do need
that's
these
a
things.
great and terrible experiment, but I think with a good lesson for all of us. And I think, and especially our med students who again are very high achievers and very disciplined, I think can get into these patterns. And I know I do it myself, and you probably do it too, where it's like I had this super long list of things that I needed to do today, and I didn't do them. So I'm not entitled to go to dinner with a friend. I'm not entitled to watch that show that I wait for and really love. I'm not entitled. I had signed up to go to this networking event, but I'm not entitled to go to it. And of course, there is a little bit of a balance. You don't have time to do everything that you want to do, but I think it's also really important that they don't deny themselves everything, because I think like the experiment you were talking about shows, then my goodness, are you not going to be able to get out of bed if you're just being so mean to yourself about I didn't get everything done, so I'm not allowed to do the fun things. You have to have some of those things in your life, the things that are important to you.
Yeah, that's a great point. Yeah, yeah. It's sort of like I'm gonna punish
Mhm.
myself for like I didn't do this thing, so it's like I'm gonna pile on and like really. I there is a one of the things that we find is like burnout
Yeah,
is such a
yeah.
huge like negative, right? Like you got to think of like the things that improve your score, but also if you just remove the things that are reducing your score, like that can make a big difference. Like lack of sleep. If if you just stop the burnout. There was one student that I remember. She was exactly what it is you described, very high achiever. Wanted to match into ophthalmology. All I did was tell her, you just need to not study, like just, do
Mhm.
your old flashcards, just don't do anything. Just stop, because, like we measured her burnout. Her score jumped by like
Mhm.
25 points without studying. literally in like a week. Like she didn't study anything and her score just jumped. And so yeah, to the power of like you just gotta
Yes.
like remove the bad stuff. And sometimes like when it's that bad, like you can
Right,
see a
right.
really,
You
really
need, and
positive
that's the other
outcome.
thing about planning a schedule. That's what I'll tell the students is you plan your schedule so that you have work time, but you also need to put on your calendar. This is free time. This is time for dinner with a friend. This is time for going for a walk. This is time where I can sit and stare at the wall or I can watch any trash TV I want to, and that's okay. Because when you plan it, then you can do it guilt free. And that's the other thing I say. If you're going to take time off, it needs to be time off. Don't spend the whole time being like, I should be working, I should be working, I should be working, because that's not relaxing and that's not time off. So being really thoughtful about what you're going to do. Sometimes I'll tell people, okay, you're going to take a practice NBME. I want you to schedule dinner with your best friend or your partner or your sister immediately after. So you take that, you run out of the house, and you go to dinner with them. So I think being thoughtful about how you schedule things, but also knowing that you are entitled to take some time off. It can't be unlimited, but and I think your point about burnout is really recognizing burnout, and when recognizing that it's actually a better investment of your time to take a half day or even a full day off. And it's not a good investment of your time to do another hour and another hour and another hour. It's a better investment to go get some sleep. And I know we're the part in our culture, this is again, boy, I haven't talked about adolescence in a few minutes here, but we're the part in our culture where we're really good at saying, like, it's bad for you to not get enough sleep, and adolescents don't get enough sleep, and med students need to get more sleep. But we haven't quite gotten to the point where we've adjusted our institutions so that they account for that. And I think some schools are doing a really good job. I put in a little plug for my own school, Stanford, which I think is really thoughtful about providing a lot of mental health and wellness for students. But we all could improve in terms of being a lot more thoughtful about what are we expecting of people, and what are we asking them to sacrifice in a way that's not necessarily helpful, and it's not necessary. Some sacrifices are necessary, as in medicine, sometimes you are just going to have to make some personal sacrifices, but some aren't necessarily necessary, and we need to have a better eye on burnout and mental health.
Yeah, no, that's yeah, and I would mirror that. I mean, that was exactly my experience at Stanford as well. It's just I thought they did a very good job of balancing those things. Um, yeah, absolutely. I'm curious. So speaking of high achievers, like you have such an interesting kind of return back to your sort of
Mm-hmm.
your very interesting cross section of work that you do. What would you say is like? In what ways are the medical students that you work with at Stanford different from sort of your the wider cross section that you've worked
Ooh,
with in other areas of your life?
I think it's actually they're kind of similar. I think a lot of the students that I work with in my private practice, just because of where I'm located, Palo Alto, and the connections I have and the referrals that I get, I think they're quite similar to each other. And so what I see more is every once in a while I'll pipe up in our dean's meeting and I'll say, I can tell you what's coming for us in about 5 or 6 years because I see what's going on for the middle school students, or I see what's going on for high school or college students, and in terms of things like what their mental health issues are, what their complaints or expectations are, or how they are using technologies to maybe not always fully do assignments and get around and cope in school. So I think it's a little bit more of that rather than seeing like really different populations. I can kind of see what's coming for us in the future, but of course not. While all of our students are high achievers, not all of them are coming from affluent backgrounds, and I think that is where there can be a bit of a struggle. You have some students that are coming in that are like, oh, both my parents are on the faculty of Harvard Medical School. And we have some students that are coming in that are first generation college students. And so I think sometimes that can be really difficult. I'll put a plug in for my boss at Stanford, Dr. Sanchez Guzman, started this fantastic program called First Gen program, where they match students can self-identify however they define first generation, and the program matches first gen first gen medical students with first gen practicing physicians, and just so they can have a mentorship. So I do find that sometimes students who aren't coming from as well resourced families may struggle a little bit, just because other students that are coming from backgrounds where they had a little bit more money, they are used to having tutoring, or they are used to reaching out for help, or talking to professors and saying, that I didn't learn from your lecture. What else do you recommend? And so sometimes I'm coaching students about advocating for themselves or reaching out for help. Another thing that I see in terms of differences is students that may be coming from better resourced families, if they need a diagnosis, if they say have a learning disability or ADHD or mental health issues, they're often already coming in with the diagnosis and the paperwork, and they did this in high school and undergrad, and they're all ready to go, and they know what they need to do in order to get their accommodations. And then sometimes I'll be meeting with students that are not coming from backgrounds like that, and I'm going, have you ever been assessed for ADHD? Or maybe you should reach out to our mental health team to talk about anxiety or depression. And then of course, sometimes those to get tested is very expensive, and so kind of helping them navigate those situations. So I think that's maybe the main difference, not necessarily in terms of like the whole population of medical students being different from my private practice, but just in terms of the different backgrounds that people are coming from. I think there's also, going back to that idea of belonging, and I used to see this when I worked a lot more with Stanford undergrads as well, is when you're not coming from a super wealthy background, you may have to work in addition, or you may have to worry a lot more about your grades to keep your scholarship than some other students. Or we provide tutors, but some people might get outside tutoring, and some people don't have the money for that. And so it's even things like, sometimes we're at Stanford, sometimes students are like, we're going to Lake Tahoe for the weekend, and other students can't afford that. And it's not only, or they have to work. And it's not only that they miss out. It's like, oh, sad, you miss out on going skiing. Well, that's not really it. What you're missing out on is connecting with friends and networking, and again, going back to that idea of belonging, but also that future networking of, I have these really tight relationships. And as you know, that's going to be important in your career. So I think those are some of the differences that we see. And again, we're trying to work on it, but like everyone else, I'm sure we could be a lot better about that.
So let's say that I was from that background. I mean, I relate much more to the, didn't grow up with a lot of resources background than I do with both of their parents are, doctors or things like that. What are things that I can do, or what are things that someone could do in that situation? Obviously, mentorship. So seeking out mentors, trying to find people. What else? What are other things?
I think there's the seeking out of mentors, but then I think, to go back to that idea of belonging, of sometimes creating your own groups. Sometimes our students create their own affinity groups or informal networks. And I think also one thing I always encourage students to do is, not to share anything that they're not comfortable sharing. And I talk about the difference between something being private and something you should be like ashamed about or embarrassed about. Sometimes things are just private, and not everybody needs to know every detail of our lives. But I also encourage students, where they're comfortable, to talk about their struggles to other people, because I think, and I'm sure this is not just an issue at Stanford, but we have this idea of the Stanford duck syndrome of the, duck on the top looks like it's just cruising along. And I talk, our students are, we're in California, we're Silicon Valley, and our students like walking around in the sun, carrying their yoga mat with a big smile on their face. And then inside, it's really hard. Like, they're often struggling. And so underneath the water, the duck is paddling and paddling, but other people don't see that. And so I do encourage people to just share. They don't have to walk around looking perfect all the time, and they can share some of their struggles, and they can share where they're coming from and their backgrounds, and it's for them to be able to open up a little bit more and maybe feel comfortable. And you never know what somebody else might be kind of holding in, being like, oh, I didn't know that I could talk about this, or I didn't want to share that with anybody, or I didn't know anybody else would have that same connection. But I think it's also part of, and not to put this on people, but like, it's also part of educating others. As a physician, you want people to be comfortable with people from all kinds of histories and backgrounds and socioeconomic status levels, and to not make assumptions that everybody, I think when we're growing up, we assume like, well, everybody's kind of similar to how my family was, because we don't have as much experience. And so I think it's also part of education to talk through what's going on for other people. So I think if somebody is feeling alone or struggling to reach out, and again, it doesn't have to be to everybody, but maybe sat next to somebody in class and they smiled a little bit and you're like, oh, do you want to study together, and slowly get to know them. And then I think also to put a little bit of the burden on, if you are somebody who you're like, I'm feeling pretty comfortable. I have students, I know people are going to watch this and be like, what, how dare they? But so I have students who come to me and they're like, medical school is not as hard as I thought it would be. Am I like missing a whole class or something? And oftentimes they've just had like maybe a better preparation for, say, the first quarter classes, and it's or some people just learn really quickly and pick up things in a certain way. And if you're that person, or if you are somebody who feels like, I do feel like I fit here and I know the system and I'm comfortable with it, maybe you could reach out to some, not in a like poor little you way, but if you notice that somebody doesn't always seem to be participating or is maybe a little quieter, you go sit next to them and chat with them. And maybe they don't want to chat with you, but maybe they do. Maybe they're just shy or not feeling like they belong, and you could be the person to, invite them somewhere or open up. So again, I think that's also a good practice for being able to connect with patients too.
Yeah, I think I'm hearing like we talked a lot about sort of seeking out mentors, but it really goes both ways, right? It's like, we can also seek out people to mentor, even if it's, peers is a great example. And that, I remember when I was a first year at Stanford, in the laundry room in the Escondido Village.
I know that laundry room.
The laundry room. Yeah, EV Studio 4. I saw one of the other, someone in scrubs, and I was like, so I knew that they must have been a third or fourth year, and so I approached them, bright-eyed, bushy-tailed, and I said, I am a medical student here at Stanford, like, what advice do you have for me? And I still remember it. She said, no one talks about their struggles. No one talks about it. And she's like, everyone struggles behind closed doors, but they don't share it. And so one of the things that I am really glad that I did was I formed, basically, she described exactly what you said. I formed like an affinity group where we just talked about the things that we struggled with. And it was the best thing that I could have possibly done in my medical school.
Yeah, it's really, really important. And to not be afraid. Like, people want to help. It's nice to have it. So if I lived in Studio 4 as well, maybe we overlapped at some point. But one of my favorite stories that I always tell is I had, this was years ago when I first started, and I was meeting with a student, and she was really down on herself. I wish I was like my roommate. My roommate just like picks up on everything so quickly, and I don't think she studies very much, but she just gets it right away. And I feel like I'm studying all the time. And, so we talked through that. Guess who my next appointment was? The roommate. And guess what the roommate said? Well, the classes are easier for me, but I really wish I was more like my roommate because she's so good with patients and she just like connects with everybody and she's so warm. And I'm sitting there going, why is everything confidential? And I said, well, you know what? Maybe you could talk to your roommate a little bit and get get some advice. But I always tell that story at orientation and at all the talks that I give, because it's just an example of how like we can be sitting there by ourselves just being like, I'm the worst and I don't belong here and I'm not good at this thing, and then somebody else is sitting there jealous of us because we have skills that they don't have. So I do encourage people, whenever they're comfortable to share a little bit about their struggles, and that we connect. We don't connect with people when they're like, I'm great, I'm so smart, everything's so easy for me, right? We connect when we open up a little bit about our struggles, and then somebody feels comfortable and they share with us. And then the only thing I do tell students is you don't want it to end up being just like a complaining session. Is, get it out, vent a little bit, and then figure out like, well, what can we do, or how can I help you, how can I learn from you, so it doesn't become just constant wallowing in negativity. You want to have a little bit of balance of being able to be honest and talk, but also choose people to be around that make you feel a little bit more positive. One thing I say about any relationship, whether it's a romantic relationship or a friendship, work relationship, we don't always have as much control over work, or family relationships, but on balance, we should walk away from that person feeling better. Not always. Sometimes people are in crisis, and sometimes it has to be all about that person. But on balance, you should walk away from an interaction with somebody being like, I feel better about myself, not worse, or I don't feel drained, I feel energized. And so those are sort of a good gauge to think about how to spend your time when you have some control over your time.
This is great advice. Well, thank you so much, Dr. Medoff, for taking the time to speak with us and sharing all of your perspectives over your many different sort of hats that you've worn over the years. If people wanted to follow you and learn more about you, what would be the best way for them to do that?
They can reach out to me at Stanford. You and I had talked before we talked. I have no social media presence. I am an old lady in body and spirit, and I am not good at that. But feel free. You can find me at Stanford if you wanted to just give me any commentary, give me any feedback about this talk, or if you're interested in working with me through my private practice, you can find me at Stanford. My email address, that's the best way to get a hold of me, is L Medoff, L as in Lisa, is my first name, Medoff. I always say my last name is Med as in medicine, off as in the opposite of on, or you could just search Stanford Learning Specialist and you will come across me, or you can connect with me. I'm on LinkedIn as well, not as good as keeping that up to date either, but find me through Stanford. So thank you so much. This was a delightful conversation, and I think just a model for, hey, you ask people for advice and they will go on and on and on. So don't be shy about asking people for advice or for support or for mentoring.